Welcome to #Wednesdays Weekly, a weekly information session in collaboration with the voluntary sector and public sector partners. This week, the host is Claire Birch from Healthwatch Rochdale. Over to you, Claire.
Hi everybody, so I'm the Information and Communications Coordinator for Healthwatch Rochdale and I'll be delivering this session. So what I'm going to do is I'm going to share my screen shortly and then we'll get started. I'm going to turn my video off as well so that you can just see the presentation. Right, okay, so today's presentation is the role of Healthwatch Rochdale and how you can get involved. So what today's session will cover. So the role of Healthwatch Rochdale, who we are and what we do. The Healthwatch Rochdale team, so we've got a brand new team. We've just gone under a restructure. There's 5 team members, but 3 of those are new. So we'll go through their roles. How partners and patients can engage with Healthwatch Rochdale. The work we've carried out since the pandemic and our future work programme. And how you can get involved. So Healthwatch is part of a network of Healthwatches. So it was established under the Health and Social Care Act 2012 to understand the needs, experiences and concerns of people who use health and social care services. So there's a local Healthwatch in every borough of England and nationally we have Healthwatch England. So local Healthwatch has statutory functions and the statutory functions for Healthwatch Rochdale are to gather the views and understanding the experience of patients and the public. So we listen to people's experiences and opinions of using local health and care services. Making people's views known. So we share views and feedback that we've got with providers and commissioners and other partners, including the CQC and Healthwatch England. And we make reports and recommendations for improvement to services based on what people have told us. 3, promoting and supporting the involvement of people in the commissioning and provision of local care services and how they are scrutinised. So for that, we encourage providers to make decisions with patient experience at the heart of those decisions. So we encourage providers to speak to the patients when they're looking at making changes to services, to get their views and make sure that those changes that are being made are right for the people. So we recommend investigation or special review of services via Healthwatch England or directly to the Care Quality Commission. So for those who don't know, the CQC monitor the quality of services. So we make recommendation to those directly, sometimes if we have any concerns that need further investigation. And we also speak to Healthwatch England and the CQC are required to respond to advice from the Healthwatch England Committee. Number 5, providing advice and information, signposting about access to services and support for making informed choices. So we give information about health and social care services to members of the public. We give them contact details for a range of services and tell them the best place to find relevant information. Making the views and experiences of people known to Healthwatch England and to other local Healthwatch organisations and providing a steer to help it carry out its role as a national champion. So that again covers the fact that we share our data with Healthwatch England. This then helps them build up a national picture of the health and social care arena, and Healthwatch England then give advice to the Secretary of State for Health and Social Care, NHS England and English local authorities. Number 7, signpost to NHS complaints advocate. So for those who want an individual concern looking into, we can make a referral to an independent NHS advocate who can help a person navigate the complaints process. Some Healthwatches provide that service, but in Rochdale, the advocacy service is provided by Advocacy Together Rochdale. the role of Healthwatch Rochdale. So our vision is to have a better health and social care experience for everyone in Rochdale. So this is what we're aiming for. We want everybody to be able to talk to us about their experiences of using services, and for those views to be taken into consideration so that services are personalised. Our mission: we are the independent voice of local people in challenging and influencing health and social care provision in the Rochdale Borough. So our mission is basically why we exist. So we're independent, we're not part of the NHS, we're not part of social care. We work as an independent voice to listen to people and then provide that patient experience to the services. Our values. So we're, like I say, we're independent, we act on behalf of all local people, and we challenge and influence those in power. Credible, we hold ourselves to the highest standards through openness and transparency. Collaboratively, we work with others locally, regionally and nationally, and we learn from people's experiences. Inclusive, we start with local people first. Responsive, we take what we know and translate it into actions. So our strategic objectives are to remove barriers so that choices can be made by all residents about their own and their family's health and social care needs. And I think it has become apparent since the pandemic that there is still a lot of barriers and a lot of inequality that needs to be addressed for people. So this will be something that we'll be looking at going forward so that we can make sure not only Healthwatch Rochdale is available to everybody, but that access to services is equally available to everybody, whether that be through obviously having information in different languages, or just looking at all those different things. Work with others to achieve the best outcomes for the provision of health and social care. So that would be working with partner organisations and patients, and deliver innovative ways of working, new opportunities, positive outcomes and value for money. So obviously we are a not-for-profit organisation, so we are on a limited budget, so it's always trying to look at the best ways of doing things for, that'll have the most impact, that don't obviously cost a fortune. So this is our new organisational structure. So we have a board of directors, and the board is made up of volunteers. So they're all voluntary board members, and it's people who live or work locally and have knowledge and experience of the health and social care system. So the board is responsible for the overall governance of the organisation and agrees our policies and oversees our work plan, etc. And then we also have the finance subcommittee and the human resources subcommittee that feed into the board of directors. Under this, we have the advisory group. So the advisory group also is made up of voluntary members, and the advisory group ensure Healthwatch Rochdale and the board are aware of the views and needs of different communities in the borough. So this will help us plan our work effectively. So it's like our eyes and ears on the ground, really. They can sort of let us know what's happening for different communities. So our advisory group is just getting up and running, but we're hoping that eventually it will be representative of the borough, the diversity of the borough. Under this, we have our staff team. So we have our Chief Executive Officer, who's Kate Jones. So she's been with Healthwatch for 6 years now, and she oversees the running of the organisation. Underneath this, we have the Information and Communications Coordinator, which is myself, Claire Birch. I've been here 5 years now. I'm responsible for the communications from Healthwatch Rochdale, the website, the social media, as well as the data and intelligence management. So our new staff members are our engagement coordinator, Tracy Coatman, and she's responsible for engaging with local people to help give them a voice in shaping health and social care services. We've got a volunteer and involvement officer, which is a brand new role to Healthwatch, and obviously she'll be responsible for the recruitment of volunteers and their development. So her name is Naomi Kenyon. So under Naomi, we also have the Healthwatch Rochdale volunteers. I think we currently have 7, but we're hoping to build on those and increase on those as well. So they will help us carry out our engagement activities, enter and view visits, etc., etc. And then we have our admin support, who's Claire Yardley. So she provides admin support to the team, and she supports us with our information, advice and signposting service and the Healthwatch Rochdale social media channels. So yeah, so Healthwatch Rochdale has just undergone a restructure, and the new team looks as follows. So Kate Jones, Claire Birch, Tracy Coleman, Naomi Kenyon, Claire Yardley. How patients and partners engage with Healthwatch Rochdale. So I briefly touched upon our advisory group. So this is local people who represent the diverse community of Rochdale. So we want these people to help us engage with those communities and tell us the best way to engage with those communities, and also make sure that their views are known to us. We've got our website, so we can provide feedback on the website. We also provide information and advice on our website, and we upload all our reports and recommendations on there. Currently, we also have, normally everything's in hard copy as well, which we give out on the ground engagement, but obviously due to the pandemic, that is currently on hold. So talking about obviously our barriers earlier, the digital exclusion is a thing that we're going to have to look at going forward. And I know we're part of a digital inclusion group at the moment that is being hosted by Action Together to look at how more people can have access to digital. Care Opinion feedback. So for those who don't know, Care Opinion is an online feedback platform. So we have a subscription with Care Opinions, so they share all the data that they receive with us as well. So we use that as secondary data. So we have our data, and then we have the Care Opinion data, and that helps, you know, strengthen any sort of trends that we're seeing. Public board meetings, Q&A. So we have quarterly public board meetings. So any members of the public can come to our board meetings. They can also submit a question to our board. We ask that questions are submitted in advance, but we publish those questions on our website and the responses as well. Currently, because of the pandemic, we're not inviting people to attend in person to the public board meetings, but what we're looking at for our next one, which is in September, is to live stream that so that people can still access it and then put it on our YouTube channel. Face-to-face and virtual engagement platforms. So prior to COVID, we had a lot of face-to-face engagement. We'd be out in the community, whether that be health and social care settings, community centres, working with different voluntary organisations, going to their groups and giving talks on Healthwatch so that we could collect those experiences. We've had to move that now to virtual. So we've just had our first mental health forum, and we're looking to build on that. Obviously, as soon as it's safe to do so, though, we would feel like to be back out on the ground doing face-to-face engagement. We also used to carry out what is known as an enter and view programme. So Healthwatch Rochdale has statutory powers called enter and view. So that means that we can go into any publicly funded health or social care setting. So we can go in there announced or unannounced, and once we're in that setting, we can make observations, we can talk to staff members, talk to people who use those services, and we collect all that data, put it into a report, and then make recommendations for improvement. So for the last 2 years, we've been running a programme in local care homes, and it's worked really, really well. And some of the care homes have took on some of those recommendations and made improvement to services based on what those residents living in the home have told us. And we're hoping to obviously carry on that piece of work. We was planning on doing it this year, but obviously with the pandemic and the vulnerability of people in care homes, that is on hold. But going forward, maybe next year we could maybe get that up and running again. Mental health forum, as I said, we've just run our first mental health forum, and they will be going, I think, every month now till the end of
March, before we plan our next work programme for the next business year. We've also got some COVID-19 forums that we're going to be running. We currently did a survey with Rochdale Borough Council, and on the back of that, I think about 96 people said they'd be interested in speaking to us on an online forum to share their experiences of using health and care services during COVID-19, what worked well, what didn't, and we share those findings with the NHS and the local authority so that they can plan and make sure services are right for people. Our partners. So we have people come to our public board meetings to give updates on their organisation, the work that they're doing, so that we're aware of the work that they're doing and our board is aware of the work that they were doing, and also we can cascade that to our service users as well. We attend statutory meetings, so we're on a range of sort of higher level meetings where decisions are made about health and social care services, and we are required to be part of those meetings, and at those meetings this is where we put forward the experiences of patients and make sure that patients are included in decisions and just basically be a conduit for their voice. Data intelligence sharing, so we share our feedback with providers to help them improve services. We do this anonymously, so we don't deal with individual concerns as such. As I said previous, that would go to the NHS complaints advocate, but what we do is we collate our data and look for trends of what's happening and make recommendations based on sort of an overall view of how well services are performing for the patient. Commissioned engagement work, so we do pieces of work that we are paid for, really small pieces of work on behalf of the NHS. Mostly we've done that. If they want to find out something or want to engage with patients, they'll sometimes come to us and ask us to carry out that piece of work. Annual 360 stakeholder engagement event. So with this, sorry, something just popped up on the screen. So we hold a 360 stakeholder engagement event. So we invite our partners to this event to have an update on our work, to learn what we've been doing, and to give their views and opinions on how they think we could improve. Healthwatch is still quite a fairly new organisation, and we're still growing. We still have a lot to do in making sure that everybody knows who we are, what exactly we do, and how they can speak to us. And so at our stakeholder engagement event, we try to work with partners to get their views on how we can continue to develop. Strategic meetings, and we also attend the Action Together weekly grassroots gathering, which we found really useful. We've been attending. We used to attend this face to face. I've been attending this now during lockdown, and I found it really useful to meet other partner organisations, because we wasn't always aware of what those other organisations were doing and how we could sort of link together. I think it's been really good for helping to build those relationships for Healthwatch with the voluntary sector. We also attend the Safeguarding Board. So our Chief Executive Officer, Kate, has a seat on the Safeguarding Board, and we do have a responsibility, as everybody does, to make sure that we follow correct safeguarding procedures. So since the beginning of the pandemic, the work we've been doing, we have carried out a survey with Rochdale Borough Council to gather people's experiences during COVID-19. So we worked with the public health in Rochdale Borough Council to create a survey to gather people's experiences, and 673 people responded to that survey. So that is going to be collated into a report
to identify themes and trends so that we can know what works well and what hasn't worked so well, and so that we can plan going forward. We've also, as I mentioned earlier, got 96 people who are wanting to take part in further research with us by attending one of our forums. And we're looking at opening this up wider as well to other members of the public. So not just those who have carried out our survey, but if there's other people who want to speak to us about their experiences. So once we've got those booked in, we'll be sharing that wider. Led a partnership communications group, Together Rochdale. So we're trying to build on the partnership communications. So Together Rochdale first started at the beginning of the pandemic, and it was partner communications officers coming together to find out what each of the organisations were doing and how we can best share those messages so that they can reach the different communities. I mean, we all have different followers and different people on our mailing lists, and you know, different people visit our website. So it was trying to open up our messages to a wider audience by sharing those messages, so that we was all reaching as far and wide as we could. This is being built on currently. So we're working with Action Together at the moment, and Europea and Caring and Sharing, and we're looking at having some videos on COVID-19 in different translated languages. We're going to have those on a Together Rochdale page on our website, and we're asking obviously those voluntary organisations who've worked with us on this to direct their service users to this page, and obviously try and share it among their friends, family and community, and just for anybody who they think may need it. Created a COVID-19 Information Hub on our website. So obviously information was changing very fast at the beginning of the pandemic. So we had a dedicated sort of COVID-19 Information Hub on our website, and it was patient-friendly advice, because obviously, yeah, a lot of the advice was on the government website, but it wasn't always patient-friendly and could be a nightmare to read through. So it condensed that information down and put it in a more readable way. So, for example, information on shielding, how to get mental health support, and then just the generic COVID-19 information, such as how to correctly wash your hands, keeping your distance, etc., etc. We carried out our first online mental health forum. So we opened that up to everybody, but it was really interesting actually, because we only had a couple of people attend, but the people that we had attend were both male, and they were from the BA/ME community, which is not a group that we always hit, either male or the BAME community regarding mental health. So we got some really, really interesting discussions there, and it was really, really good to get that insight. So those recommendations will be being made to the local mental health partnership board. We took part in a national Healthwatch and CQC campaign on hospital discharge, and that's still ongoing. It's called #BecauseWeAllCare. So we are looking at the hospital discharge process during COVID-19, because that obviously changed due to the pandemic. So we're trying to collect people's experiences on that, and we're not just encouraging people to talk to Healthwatch. You know, talk to us if you want to talk to us, talk to the CQC, or talk direct to the provider. But what we do want is people to talk and share their experiences so that the NHS can know. Our future work programme. So we're going to look at inequalities across the Rochdale Borough Health and Social Care system. As I said earlier, it's become very apparent. We all knew inequalities existed before, but I think this has been exacerbated by COVID-19, and this is something that we want to work on trying to eliminate along with all our partner organisations. It's not something Healthwatch Rochdale can do alone. It's not something any service can do alone. I think we all need to work together to look at how we can do that. We're going to be holding monthly virtual mental health forums via Zoom. And as I said, these forums are going to feed into the Mental Health Partnership Board. Review and implement more virtual engagement forums. So this will take place of our face-to-face engagement. We're looking at COVID-19 forums and mental health forums at the moment. And yeah, facilitating partnership with RBC, focus groups on various topics following our COVID-19 survey to gain further people's individual experiences. Internal and external Healthwatch Rochdale advisory group development. So we're still looking for members to join our advisory group so that it can reflect the diversity of the Rochdale Borough. We're going to begin a youth health watch. So this is something some health watchers have done before. We haven't got one in Healthwatch Rochdale, but we're hoping to build one. Now we've got our volunteer and involvement officer in post, and this will be basically members of the youth, young people, who can tell us what's worked well for them and what hasn't worked well and how changes could be made. And I think we can all sort of agree that sometimes with the restrictions on COVID-19, the youth has been overlooked somewhat. You know, they've had no access to schools, they've had disruptions in their education, no access to their friends, which is very, very important to young people, as we all know. So we want to learn about what the experiences have been like for them and how things could be made better. We're going to be holding some care home forums. So as I said previously, we were doing interim views in care homes. This work is not going to be able to go ahead, at least for the remainder of this year. So we still want to engage with those communities though, because I think obviously sometimes, especially residents in a care home, they can be a bit of a hidden voice. So it's really, really important that we still get to speak to those people. So we're going to look at how we can do that. We're going to try and work in partnership with Rochdale Borough Council to see how we can try and speak to families and carers and residents in those homes. Improve the triangulation of data sharing on patient experience across the borough's strategic health and social care meetings. So that basically just means have our data used alongside other data from health and social care services to make sure that we've got an overall picture of how services are performing. How you can get involved. So you can join our advisory board and represent your community. So whether that would be mental health, and obviously, you know, you can either be a patient or work in those areas. So mental health, learning disabilities, BAME communities. We're really looking to reflect that diversity. Share your experience of using local health and care services. So the more that people speak to us, the stronger our evidence is. As I stated earlier, we look at the collective voice. So it's really, really, the more that people say something's happened for them and we can look at the broader picture, the stronger our evidence is. Encourage your friends, family and communities to share their experience of using health and care services with us. So again, that's the same reason it helps strengthen that evidence. Partnership working. So we're always looking for ways we can work in partnership with other organisations. So we really, really want to, we've always worked in partnership with other organisations and we want to continue this and really, really grow and strengthen this going forward. As I said, we've got the Together Rochdale Partnership comms group that we're building on. Tracy will, our engagement coordinator, will also be looking to build relationships with other organisations so that we can speak to their service users and help them have a voice in shaping health and social care services. And if you're on social media, you can use the hashtag Together Rochdale on Twitter to promote any partnership piece of work involving organisations working together or members of the community. So our new translated languages videos that have been made in collaboration with Healthwatch Rochdale, Action Together, Europea and Caring and Sharing. When we promote that, we'll be using the hashtag Together Rochdale, and the page that they're on the Healthwatch Rochdale is also going to use the hashtag Together Rochdale to just reflect that it's a partnership piece of work. So it's not one person's piece of work, it's everybody working together. Do you have any questions?